Hi, everybody. Dr. Daniel. And today I'll be podcasting on the subject of Emgality for migraine and cluster headaches. Emgality has been approved by the FDA for prevention of both migraine and cluster headache. So Emgality is a new calcitonin gene-related peptide that's usually abbreviated as CGRP for preventing migraine. The migraine process generates three neurochemicals called neurokinin A, substance P, and CGRP. And these neurochemicals are released by the ganglia of the trigeminal nerve and cerebral arteries. They inflame the trigeminal nerve, the cerebral arteries, and the thalamus. They also cause the cerebral arteries to dilate. The thalamus is the pain center of the brain, and only migraine inflames the thalamus like migraine does. Triptans, if taken early in the migraine process, within 20 to 40 minutes after headache onset, block the release of these inflammatory neurochemicals and are the best drug currently for acute therapy for migraine. Research involving cannulating the jugular vein and sampling chemicals in the blood as it leaves the brain has revealed that these neurochemicals are released by the migraine process. So after a migraine starts, there's an increase in the three inflammatory neuropeptides, and they go to the liver, and then out of the body to the toilet. Emgality blocks the activation of CGRP and is a new drug for migraine and cluster headache prevention. And none of the older drugs for migraine work like this, and currently we have not had a preventive drug for migraine until Emgality came out. So, does Emgality work for migraine? Emgality is a humanized monoclonal antibody used for the prevention of migraine and cluster headache. It's had grand success in treatment. And it's given as a subcutaneous needle injection either in the top of the thigh or near the umbilicus in the stomach. And for migraine, Emgality is given as a 120 milligram subcutaneous injection. Two of those are 240 milligrams the first day of start of treatment, and then 120 milligrams or one shot every month thereafter. For treatment of cluster headache, they're 100 milligram syringes, three of them delivered to the patient, and they take 3 shots every 3 months. The only precaution regarding using Emgality is it should be stored in a refrigerator in its original carton to protect it from the light. And the needle should be left at room temperature 30 minutes before injection. The really beautiful thing is that Emgality does not interact with other drugs. Amazing. Most drugs have 10 or 12 different drugs you can't take, but not Emgality. And it's made by DNA polymerization and then injected into the body. CGRP drugs are made by this polymerization process of spitting out strands of DNA. It's a completely novel method of drug production and safe regarding use with other existing drugs. Well, what are the side effects for Emgality? Serious side effects are hypersensitivity reaction, which is very rare. But common side effects are an injection site reaction, like a small bruise, like when you have blood drawn from your lab, or muscle cramps or spasms. Emgality for migraine could prevent headache in 50% of patients, 75% of patients, or another group of 100% of patients. So for migraine, some patients may have a migraine-free month, and that's just incredible, really. Emgality reduced cluster headaches over a 3-week trial in comparison with placebo by 8.7 patients. Some drugs, like triptans for migraine, have a cardiovascular and cerebral vascular risk, but Emgality doesn't have any of those side effects. So the FDA has approved Emgality as the first ever treatment for episodic cluster headache in patients and reduced frequency of attacks. I want to talk about the similarities and differences between migraine and cluster headaches. You get that straight in your head. So, except for rare findings of one-sided eyelid drooping, which is called ptosis, and one-sided pupillary smallness, called miosis, found only in older patients who have had cluster headache for years and called Horner syndrome. Most migraine and cluster headache have a normal neurologic exam. They have a normal MRI scan and normal brain scans. Now, migraine patients may have microvascular T2 lesions, which really don't mean anything as far as we know. And I humorously call those migraine freckles because we can see them, they're benign, they don't mean anything. Episodic migraine usually occurs only once several weeks, like 2 times a week or something like that, or maybe once in the cycle, the menstrual cycle for women. But cluster headache, when it starts, comes every day, and it can come up to 8 times a day for short headaches that last 10, 15, 20 minutes, whereas migraine may last 4 to 72 hours. Cluster headache has a lot of autonomic features with it, in that it may have sweating above the forehead, drooping of an eye, smallness of a pupil, all on the same side, redness of the conjunctiva, tearing from the eye, congestion of the nasal nostril just on one side with sometimes dripping called rhinorrhea. Also, the behavior of patients with cluster headache and migraine is different in that migraine patients want to lie down, while cluster headache patients have to get up and walk around. Cluster headache has been called suicide headache because they're so bad people want to kill themselves during that time. And cluster headaches, but not migraine, cluster headaches will lock into the clock in your head so that if someone goes to bed around 11 p.m., cluster headaches may come 2 hours later, say at 1 o'clock in the morning. It may come every day. Or it may come then, 1 a.m., it may come at 9 o'clock in the morning every day. It kind of clicks into the pineal gland, the sleep cycle. Now, the headache has a cluster time, which usually lasts 6 to 12 weeks. And the cluster here means the headaches cluster together in time, much like grapes cluster together on the vine. So the patient may say something like this. Well, he'll tell you, I had 6 weeks of headache in March and April of 2017. The headaches completely stopped. And also cluster headaches can come in spring and fall, and migraine does that a little bit too. Following this, there are no headaches in all of 2018, but they started again in March of 2019. Then that's why they came to see the doctor. So although the usual cluster period is 1.5 to 3 months, the average cluster time is 6 weeks. 10% of patients develop chronic cluster-type headaches all year round. And then these patients, the term cluster is meaningless. And Emgality has only been proved for 90% of cluster patients with the so-called episodic but not chronic cluster patients. Also, cluster patients may cycle between intermittent or typical cluster pattern. And I don't want to mix up migraine that's overtreated with drugs like caffeine, Tylenol, Advil, opiate narcotics, butalbital drugs to cause medication of his headache. So a migraine patient may get chronic migraine also due to medication of his headache. They may have headaches every day. And that's not cluster headache. Cluster headache patients have headache free time in between their attacks, which, as I've said, are usually 3 or 4 times a day, but can be up to 8 times a day. But migraine patients may have headache all the time, every day for a year, 6 months, or something like that. Episodic migraine just comes maybe a couple of times a month. And migraine can last 4 to 72 hours. A cluster headache doesn't last that long. Both entities will have a good response to acute therapy to triptans. On there, 7 triptans, but cluster headache patients respond best to quick treatment in 10 minutes, and that can be found with injectable sumatriptan, 6 milligrams mainly. There's a nasal spray of sumatriptan and zomatriptan that can help some too for cluster patients. Another problem in America is that poor insurance coverage for sumatriptan, and the FDA doesn't have any indication for using triptans for treatment of cluster headache. So it's always an eternal problem trying to find acute therapy drugs for cluster patients when you see them in the office. My last big statement here would be that Emgality is not approved for breastfeeding, that is lactation, or during pregnancy. So I hope this podcast is helpful to you folks who've had migraine and cluster type headache. Please click on subscribe so we can follow each other. And I will see you again on the next talk.